Current presentation is covering concept 4D, clinical judgment. Clinical judgment is required in care delivery. Judgment makes it possible to simultaneously apply knowledge, skills, and attitude in order to solve clinical problems in a specific context. Nurses must deal with a broad range of issues related to the conditions of each patient and may include complications and improvements, as well as annotation to clinical records and communication with delivery. Judgment guides actions and decisions not only of the nurse, but also the physicians and other care providers. It is therefore essential for the nurse to have observational and reasoning skills in order to make sound, reliable clinical judgments. After this presentation, you should be able to define and describe the concept, discuss the attributes of clinical judgment, identify the ways that nurses make judgments, and discuss the context to nursing and healthcare. Concepts of critical thinking, clinical reasoning, and clinical judgment are often used interchangeably. However, they are not one and the same, and understanding the subtle difference among them is important. The terms critical thinking, clinical reasoning, and clinical judgment are interrelated concepts. Each represents an important set of processes leading the nurse to sound, evidence-based practice. Critical thinking is the cognitive processes used for analyzing knowledge based on evidence and science. It is knowledge-based and it is not dependent on the situation at hand, but rather on the knowledge about the subject that the nurse possesses. Critical thinking is a key skill or process that is essential for clinical reasoning. Now we are going into the next one, which is the clinical reasoning. Clinical reasoning represents the cognitive and metacognitive processes used for analyzing knowledge relative to a clinical situation or a specific patient. Metacognition is, to say it very simple, thinking about one's thinking. More precisely, it refers to the processes used to plan, monitor, and assess one's understanding and performance. Metacognition includes a critical awareness of a few elements. First will be one's thinking and learning, and the second will be oneself as a thinker and a learner. Clinical reasoning is a necessary cognitive and metacognitive component of the clinical judgment in nursing. Clinical reasoning can be developed within the practice of nursing through the use of decision trees and algorithms, thinking aloud, and reflective journaling. Now, moving into the third part will be the clinical judgment in nursing is that cognitive, psychomotor, and affective process demonstrated through actions and behaviors within the 4 phases of the clinical judgment. And the clinical judgment is made out of noticing, interpreting, responding, and reflecting. So clinical judgments require that the nurse recognize the unique situation of the patient, originating from the deep knowledge of a variety of interrelated physiologic and psychosocial concepts, resulting in a profound understanding of the clinical situation. Clinical judgment requires the nurse to apply knowledge, both tacit and explicit, to the unique patient situation to make sense of it and to respond appropriately in the specific context of care. The standards-based approach is a rules-based best practice type of nursing care. This approach often involves use of algorithms and decision trees and patient care guidelines. All those tools provide clear-cut guidance that will standardize the approach to the patient care within an institution based on best practices for a typical patient population, and they are very important to the general patient care quality. The standardized tools can be very useful to support safe patient care, especially for the beginning clinician who lacks knowledge and/or experience. However, their use may or may not result in the best possible care for a particular patient in a given situation. They also may limit options and creative solutions. A principle that relates decision-making tools to clinical judgment is that if there is a rule that covers the situation, the clinical judgment is not required. However, clinical judgment may be required in decision-making about whether or not a given standard is applicable or appropriate in a given patient care situation. In fact, research has shown that although standards or guidelines may be useful beginning points, expert nurses rarely use them alone. This is because the expert nurse nuances his or her understanding of the individual patient situation along with knowledge of standards to employ a much more interpretivist approach. So, interpretivist approaches recognize that one circumscribed approach is often not appropriate for a large number of patients. The nature of nursing care is not linear, and in fact, in numerous situations, there are many unknowns. Therefore, approaches that consider multiple factors in clinical reasoning are often more appropriate. Because there are often no clear-cut answers about nursing care, or because of the influence of the individual patient's circumstances and context of care, clinical judgments by nurses become very specific to a given patient care situation. Interpretivist approaches situate the nurse squarely in the context of care and account for what the nurse personally contributes to the caring encounter, including previous experiences, values, and emotions. The creation or construction of understanding the patient and caregiving situation using empirical knowledge of the patient, and knowledge of the clinical environment facilitates decision about care, and thereby setting the stage for what the nurse notices and how the nurse interprets and responds. Reasoning in interpretivist approach may involve a rule of thumb method and can be intuitive. It involves understanding and knowledge, is often inductive in nature, and is referred to by some authors as engaged or practical reasoning. To compare and contrast with that, rules-based approaches tend to rely heavily on analytic reasoning that requires systematically dividing a situation into their individual parts, examining alternatives and weighing options. One example of the analytic approach is diagnostic reasoning, considering the evidence that supports each diagnosis. All clinicians are expected to use the best evidence to inform practice. Use of evidence-based guidelines informed by research improves patient outcomes. It is important to note that clinical judgment is an integral aspect of safe implementation of evidence-based practice, or EBP. So EBP is defined as applying the best available research results or evidence when making decisions about healthcare. Healthcare professionals who perform evidence-based practice use research evidence along with clinical expertise and patient preferences. As implied in the definition, EBPs is implemented with clinical judgment. Safe and effective nursing care requires scientific knowledge as well as practical experience to understand when particular research evidence is relevant. The nurse must accurately assess the patient and care context and then apply the EBPs that are most appropriate in a given situation. Clinical judgment also guides nurses to question current practices and consider when guidelines need to be updated. Using the interpretivist perspective of clinical judgment and clinical reasoning, the clinical judgment can be seen as having three significant defining attributes that are useful to understand the concept. First will be the holistic view of the patient situation, and clinical judgment is inherently complex and influenced by many factors related to the particular patient and caregiving situation, and it therefore requires a holistic type of view. Making excellent clinical judgment requires a willingness to consider all factors involved in patient care, including certain characteristics of the nurse, and is much more than simply a combination of the individual aspects. A second part will be the process orientation. The clinical judgment is circular, interactive, and moves fluidly between and among all of the aspects of the process. To make clinical judgments, the nurse employs a deep understanding of the individual patient situation and his or her own background, experience, and values. Patients and nurses are unique and bring different backgrounds to the caregiving situation. The nurse notices relevant features of a situation based on these factors and intervenes, while the nurse observes the patient's response. He or she will determine what the next steps are going to be. After the caregiving situation, the nurse will connect the patient outcomes in a way that enhances further understanding of future patients' care utilizing reflection. The last element will be reasoning in interpretation. Clinical judgment involves reasoning and interpretation, and as described before, reasoning is the process that leads to clinical judgment. There are at least 3 types of reasoning that can be used. We have the analytic, intuitive, and narrative type. The type of reasoning used depends on the caregiving situation and the nurse's previous experience. When a situation is unfamiliar, the nurse, regardless if they are an expert or a novice, tend to rely on analytic reasoning processes, consider the possibilities, and deduce the solution. At other times, the expert nurse may recognize the situation immediately and act intuitively and tacitly. Nurses may also process their reasoning in a narrative form, that is, recognizing the significance of the situation at hand to the patient's experience with illness and engaging in interventions based on this understanding. Through observation, the nurse will determine the uniqueness of each patient's situation. And by utilizing an understanding of the clinical situation and based on his or her knowledge and experience, and by applying clinical reasoning and critical thinking, the nurse will come to a clinical judgment. Now, remember that clinical judgment is an interpretation or a conclusion about a patient's needs or concerns or health problems, and or the decision to take action or sometimes not to take action, use or modify standard approaches, or improvise new ones as deemed appropriate by the patient's response. As each patient situation, and nurse is unique, so too is the clinical reasoning and judgment resulting out of it. We'll discuss now a few of the theoretical links regarding what is called think like a nurse. Tanner identified 5 assumptions of clinical judgment in nursing, and those will be: 1. Clinical judgments are more influenced by what nurses bring to the situation than the objective data about the situation at hand. 2. The sound clinical judgment rests to some degree on knowing the patient and her typical pattern of responses, as well as an engagement with the patient and his or her concerns. 3. Clinical judgments are influenced by the context in which the situation occurs and the culture of the nursing care unit. 4. Nurses use a variety of reasoning patterns alone or in a combination. And 5. Reflection on practice is often triggered by a breakdown in clinical judgment, and it is critical for the development of knowledge and improvement in the clinical reasoning. So Tanner's model of clinical judgment is based on over 200 research studies investigating the way nurses think in practice. The overall process will include 4 aspects, and please take a moment and look at the image. First of all will be a perceptual grasp of the situation at hand, termed noticing. Developing a sufficient understanding of the situation to respond, termed interpreting. Deciding on a course of action deemed appropriate for the situation, which may be no immediate action. And this part is called responding. And attending to patient's response to the nursing action while in the process of acting, and this one is called reflecting on it. Reviewing the outcomes of the actions and focusing on the appropriateness of all of the preceding aspects, for example, what was noticed, how was interpreted, and how the nurse responded. In this model, noticing is not a necessary outgrowth of the first step of the nursing process, assessment. Instead, It is a function of nurses' expectations of the situation, whether or not they are made explicit. These expectations stem from nurses' knowledge of the particular patient and his or her patterns of responses, their clinical or practical knowledge of similar patients drawn from experience, or their textbook knowledge. For example, a nurse caring for a post-op patient whom she has cared for over time will know the patient's typical pain level and responses. Nurses experienced in post-op care will also know the typical pain response for this population of patients and will understand the physiological and pathophysiological mechanism for pain in surgeries like this. This understanding will collectively shape the nurse's expectations for this patient and his specific pain levels, and will set up the possibility of noticing whether those expectations are met or not. Using the particular patient data as well as the theoretical and experiential knowledge, the nurse will begin to put together all the information to make sense of it. For an expert nurse, certain data carry more weight than others with respect to a specific patient. For example, in the long-term care setting, a patient's age and kidney function may well impact the nurse's clinical judgment about using ibuprofen for pain relief, even though the drug may be ordered. The nurse uses reasoning to make that determination. According to Tanner, expert nurses draw on a variety of reasoning, analytic, intuitive, and narrative, in order to interpret the meaning of what has been noticed. The type of reasoning used seem to vary with the experience of the nurse. Novice and less experienced nurses will use deductive reasoning rules and comparison of the patients with a textbook in a very systematic type of analysis. The expert nurses, however, look at the whole picture and will use a pattern recognition, and they will use their intuition derived from their experience in order to make the judgments. Let's talk now a little bit about responding and take a second to look at this image. And it's obviously in this picture that the lady is responding to most probably her performance evaluation. And what I can tell you upfront is that she's obviously not a nurse, because we see that her punching jerks are in the face of her evaluator. Responding then is the implementation of actions and interventions based on the patient needs, or deciding that no action is needed at all. We'll discuss now the last aspect, and this will be the reflection. Reflection in action and reflection on action together will made out for a significant component of the model. Reflection in action refers to the nurse's ability to read, so-called, the patient, how he or she is responding to the nursing intervention, and to adjust the intervention based on the assessment. Much of this reflection in action is tacit and not obvious, unless there is a breakdown in which the expected outcomes, the nurse's responses, are not achieved. Reflection on action and the subsequent clinical learning completes the cycle. Showing what nurses gain from their experience will contribute to their ongoing clinical knowledge development and their capacity for clinical judgment in future situations. As in any situation of uncertainty requiring judgment, there will be judgment calls that are insightful and astute, and those that result in horrendous errors. Each situation is an opportunity for clinical learning, given a supportive context and the fact that the nurse will have developed the habit and skills of reflection on practice. To engage in reflection requires a sense of responsibility, connecting one's actions with outcomes. Reflection also requires knowledge outcomes, knowing what occurred as a result of the specific nursing act. Clinical judgment is an essential aspect of nursing care of all patients and all kinds of patient populations. Nurses in all specialty areas and practice settings, regardless if they are in public health nursing, community-based nursing, long-term care, or acute care, will exercise the clinical judgment. Therefore, it is considered an essential skill of the professional nurse. However, it is not required for every patient care activity or intervention. Some nursing actions are obvious. For example, post-anesthesia recovery nurse knows that it is appropriate to take an immediate post-operative patient's vital signs quite frequently in the first few hours in order to recognize early signs of any kind of issues. That is based on the nurse's knowledge that patients can sometimes have breathing or circulatory difficulties following administration of general anesthetics and the performance of a surgical intervention on them. The nurse also knows that the earlier such a sign and symptoms is identified, the better the outcome for the patient. As I mentioned previously, the context or the setting of care will influence what a nurse will notice. The specific environment of care also has a significant influence on the care delivered. Demanding environments of care can increase the burden to making clinical judgments and can actually interfere with a competent clinical judgment. On the other hand, the context may also be a boon for easing the burden of the clinical judgment. And for example, consider the case of a patient that has a myocardial infarction and is right now in the emergency department where a wide range of medications, including oxygen, are readily available. Monitoring devices are already on the patient and in fact may have signaled an impending life-threatening dysrhythmia. Nurses in this context are trained to respond quickly and confidently because of the setting. They are anticipating emergency situations. By contrast, consider the nurse who encounters a person experiencing a myocardial infarction in a public setting such as a park or church. It's a very different setup and the actions will be different, including making a decision about what to do first, who should call for help, who should be involved in the resuscitation process, and how long the resuscitation should be continued. Clinical judgment or thinking, especially thinking like a nurse, requires a deep clinical knowledge and several types of thinking. Not surprisingly, deep clinical knowledge will provide a nurse with the background needed to recognize patterns and therefore to be able to differentiate and observe it when those situations will occur in a patient. As nurses become more experienced, the clinical judgment becomes more intuitive, and the nurse instantly will recognize the patterns or will grasp the meaning of the situations they have previously encountered to immediately know what their response to the situation should be. It may appear that experienced nurses have not engaged in all aspects of clinical judgments only because they are so quick in responding, but in fact, all those aspects may occur almost simultaneously and subconsciously. A novice will tend to treat all pieces of information with similar importance. They may have difficulty identifying the most important aspects of a given situation. Early in practice, it is more challenging to individualize and contextualize the patient care. An expert nurse will look at the whole picture and use a pattern recognition and intuition derived from their experience to make the judgments, whereas those with less experience most often will use deductive reasoning and rules and comparison of the patient with a textbook in a very systematic analysis of the situation. Clinical judgment is a process that develops over time in the nurse who consistently reflects in action and on action and responds accordingly. And I'm quoting Capellati, Engel, and Prentice. Those researchers recognize the importance of reflection on the development of clinical judgment. Without this reflection, the novice nurse will gain experience, but not what is called expertise in the field. Take a moment and look at all those concepts that are related to patient care and are interrelated with a clinical judgment. Please read in the book, in your textbook, the featured exemplars and determine how clinical judgment comes into play in each of those situations. Question 1. What comprehensive approach to clinical judgment was developed based on 3 decades of clinical judgment research and through an extensive review of research done primarily with expert nurses in practice? Your options are 1. Standards-based approach, 2. Interpretivist perspective, 3. Holistic view, or 4. Model of clinical judgment. Correct answer is number 4. The model rests on assumptions about complexities in the environment of care and the interplay of those multitude of factors that affect the nurse's clinical thinking. Question number 2. What is the most often the impetus for clinical reasoning and is critical to making an effective judgment to address a patient's issue? 1. Noticing. 2. Education. 3. Listening. Or 4. Expecting. Correct answer is 1. Noticing. The nurse develops expectations about potential patient needs that set the stage for noticing. Question number 3. What approaches involve rule of thumb methods? The options are 1. Standards-based, 2. Interpretivist, 3. Clinical judgment, or 4. Interpretative. Correct answer is number 2. Interpretivist. Reasoning in interpretivist approaches may involve rule of thumb methods and be intuitive.